Dear friends, worthlessness, helplessness, hopelessness. Yes, we all have read and learnt about this famous Beck's cognitive triad. Not only learnt, but also most of us might have suffered from the same. We can't deny that. One or the other point of time in our life, we all go through the same phase of this is nothing but the depression. We call what we diagnose it as a depressive disorder. So, but this whatever psychiatric disorders are there, like depression, anxiety, all these are preventable causes. But unfortunately, there are no people to guide us properly in this regard or to treat us properly. But to create an hope through an action today, on the days of World Suicide Prevention Day, on recently concluded on September 10th, and upcoming Mental Health Day on October 10th. Today we are having this special session of prevention of major depression and also suppression and suicide. As we all know, in our medical fraternity, it is very common to see professionals committing suicide, even the students for that matter. Studies have showed that suicide is the second most common cause of death in the age group of 15 to 29. Why is it so? The most common cause in when the psychiatrists and psychologists have done the psychological autopsies, it has found that the most common cause for these suicides are the major depression, bipolar disorders, schizophrenia, and other substance abuses. So as we can understand the logic itself, all these causes are preventable, but either a denial to take the help or the unavailability of the experts to guide properly, we are losing every 40 seconds 1 person because of suicide in our world. Every third second 1 person is trying to commit suicide, and every 40 seconds we are losing 1 person. But to do something different and to create hope amongst all those who are suffering from these illnesses, in our White Army, we have today a special person, and my best friend today is a celebrity psychologist, well-known TEDx speaker, and a national leadership program coach, and also founder of a Manosamvaada Foundation, and a keynote speaker in very well-known international conferences, and many such credentials to his credits. Yes, is Mr. Akshara Damle. He's a practicing psychologist in Bangalore. So when we requested him, he readily accepted to be in a White Army platform to help all those who are suffering or need help in this regard. On behalf of all the members, we wholeheartedly welcome Mr. Akshara Damle for this session. Thank you for being with us, sir. And over to you.
Thank you so much for your kind introduction. And it is a very heartening situation for me to be with you. And also very happy to be addressing on this topic to the medical fraternity, because of the lot of respect that I have for all you doctors. So let's get into the session. It is a wellness session. So I request all of you to be there, and please avoid using your social media, any platform for that matter, because we care for you, and I'm sure all of you care for yourselves too. Not just that, you will witness transformation happening within yourself by the end of this session. That is my guarantee, and that will happen definitely by the end of this session. So throughout though it is a webinar, we appreciate your active participation. You can answer questions that I pose in the webinar, and also keep your mics muted. And we are also encouraged to answer questions asked during the webinar. And the objective of today's session is to understand vulnerabilities, to deal with the present situation in a better way, and prevent depression, suppression, and suicidal ideation. Before getting into the session, I acknowledge your contribution to humanity. Gratitude to all of you who have served people day and night, especially the whole world was going through the pandemic. Of course, we have not come out of it totally. However, we are mostly in towards or almost towards normalcy. And to all those who are still in the budding stage of becoming doctors, my best wishes, because you're all going to touch the hearts of the people, not just through the telescope, but also through your work. Now, one of the fundamental questions that I ask with all of you here is, how many of you are open to have a conversation about mental health status with others? Can I have a few responses on the chat box? In case if you are watching on YouTube or Facebook Live, then answer it for yourself so that you are acknowledging whatever you believe in. Great. Now let us see what India has spoken in the history, in the traditional aspect of mental health. Yoga chitta vritti nirodha. Yoga is restraining the mind from taking various forms, said in second sutra of Patanjali's Yoga Sutra. Manovahasrotas, one of the primary channels named in the Ayurvedic tradition, is the channel of the mind. So both yoga and Ayurveda have spoken or given significance to mental health since time immemorial. However, in the modern Indian perspective, mental health is mad. We consider whoever talks about mental health issues as pagal. And that is why we have been going through all these issues and have been stigmatizing the whole mental health perspective. Now, let us get into the topic of mental health and how we can really take care of our mental health, take care of our mental wellness, and stay mentally sound. Before getting into that, what are the major psychological issues that we are seeing in the present time? If all of you can just respond or make a note of what are the things that you are going through, then it will be easy for you to recognize the issues that you're going through. We are witnessing fear, anxiety, stress, sadness, hopelessness, confusion, guilt, sleeplessness, lack of interest, loneliness, anger, and so on. So as individuals, as you all are here, my humble request is go through the list and recognize what are the issues that you are going through as an individual so that we can start recognizing the real problems or the real issues that we are going through in our daily life. My humble request is go through the list and recognize what are the issues. How many of you are facing these issues? You can type it in the comment box, or you may share it in the private chat to me. Or if you are recognizing through YouTube, then you can recognize it for yourself so that you are aware of what you are going through. All right, let's move on. Okay, a few of us are going through stress, anxiety. Few of us are going through panic attacks. Let's get into the topic of depression. Now, a lot of us do have a kind of confusion between how do we distinguish between sadness and depression. So this is fundamental thing that we all need to understand for two reasons. One is a lot of people are labeling ourselves as depressed even when they are just experiencing sadness. This is something that we all have to be very careful about. Sadness is temporary, depression is long lasting. If you are experiencing sadness for a prolonged period of time, that is when we consider it as depression. Hence, please make sure that you are distinguishing between sadness and depression. And one more thing to note down is if you have gone through a very pathetic situation, a very traumatizing situation, and you are feeling sad, then it is normal and it is natural. So you don't have to label yourself as depressed. However, if the same sadness is experienced for a longer period of time, then that may be a cue that you may be turning out to be depressed. Other symptoms that we need to focus when it comes to depression is, do you have changes in sleep? When I say changes in sleep, some people end up sleeping for prolonged period of time. Say they will be sleeping for 10 hours, 12 hours, 15 hours, or complete days together, which is also an abnormality. And some people may be going through insomnia, which is also an essential cue that it may be a symptom of depression. And are you getting disinterested in any activity for that matter? Do you feel sad or do you feel disinterested even when you're watching a video, even when you're watching a movie, or even when you are expected, or even when you are invited to meet a gathering or be in a gathering? So these are all also kind of hints that you may be going through depression. And is there any loss of appetite? Of course, as doctors, you will know hundreds of reasons for loss of appetite. I'm not talking about that. In case if there is sadness, lack of interest, changes in sleep, and loss of appetite, then probably it is a kind of symptom of depression. And those who are going through depression also experience a lot of suicidal ideation. Why I'm talking about symptoms is primarily because I know that I'm talking to doctors fraternity or medical fraternity, and recognizing the symptoms is the first step for all of us in diagnosis. So once you are understanding what depression is, let's see how we can deal with it. But before that, let us also see what suppression means. Well, how many of you are going through fear, and fear of any kind for that matter? How many of you are going through fear of darkness, fear of heights, fear of social gathering, fear of closed space? It can be fear of any kind. And we are all human beings, and we do go through different kinds of fears. And in order to address fear, the first step is, are you acknowledging that you have fear? Right? That is the first step. And where is the fear coming from? That's the second thing that you need to look at. Where are you getting this fear from? And the third step is, where do you experience it in your body? Say very often people think that mind is in the brain. Not at all. Mind is beyond our body, and mind can be there in any part of our body. So when you're experiencing fear, are you experiencing it in your abdomen? Are you experiencing it somewhere near to the diaphragm? Or are you experiencing it in your heart or chest region? Where is that you're experiencing? That is something that you need to look at. And what have you been doing when you're scared? So that is also something very important to see. What is your coping mechanism when you feel scared? And whether exposure to media is making you fearful, that is also something that you can check. The second aspect that I would like to cover here is anxiety. What are the changes that you can see in your body? Like shivering, profusely sweating, trembling, or becoming numb, and so on. So these are some of the symptoms of anxiety, and what is bothering you, please write it down. Do you have any panic attacks? Panic attack is the severe stage of anxiety where you are profusely sweating and you are going dark and you do not know what to do and you're going numb. And whether the anxiety is about a specific issue or a generalized anxiety. So these are some of the questions that I'm throwing at you so that you can go for a self-analysis and understand what it is. The third aspect that I would like to cover, because under suppression, these are the three major things that I see. The negative thoughts, a lot of us do have several types of negative thoughts. What will happen? What if I don't do something well? Or what will happen what if things don't happen the way I want? So there can be many negative thoughts. So are you becoming restless because of the negative thoughts? Do you have a sense of extreme vulnerability? Do you see the future as dark? Do you feel that you are worthless? Do you feel helpless? So these are something that you need to look at. Well, the more you resist, this is something that I request all of you to find out or discover for yourself, that the more you resist, it persists. Which means the more you resist to acknowledge that you have fear, that you have anxiety, that you have negative thoughts, it will persist in you. Hence, it is very, very important for us to acknowledge. What do we do then? How do we resolve this? Of course, I'll come to that a little later. Before that, I would like to discuss a few more things. Let us understand, why do we suppress all these vulnerabilities or all these emotions of fear, anxiety, negative thoughts? Why are we suppressing all this? Do you have any answers? Can we have some sharings on the chat box so that I get to know if you are suppressing, why are you suppressing? Whether it is fear, whether it is anxiety, or whether it is negative thoughts, any of those vulnerabilities, why do we suppress? Why do we keep it for ourselves? Why do we hide it from others? Well, the answer is very simple. Can I be very truthful and blunt here? We are afraid to acknowledge our vulnerability. First and foremost truth is we are afraid to acknowledge our vulnerability. The second truth is we are afraid to appear weak in front of others. We have always been taught to be strong. Whenever there is a difficulty, whenever there is a challenge, we are always taught to be strong, right? The third truth is we are afraid to be real in social circumstances. We are afraid to be real, the real being in a social circumstance. And we are also afraid to be truthful to our emotions. We are afraid to be truthful to our emotions. Of course, I'm also getting a very interesting response. We are afraid of made fun of. We are afraid that people may make fun of us. Very precise. And also, we live in this imaginary, or we live with this imagery that we are very strong while we are not really that strong. Right? And the last but most important reason is we are afraid to wither away the false identity that we have created for ourselves. We are afraid to wither away the false identity that we have created for ourselves. That is why we are afraid, and hence we suppress all kinds of vulnerabilities that we have. And what's the outcome of that? What is the price that you pay when you are suppressing all these emotions? Please be careful. I am taking you all to a very difficult discussion here. We are all doing a very serious conversation wherein it's a matter of concern, not just for you as an individual, not just for your family, but we as a society. World statistics says that more than 7 lakh people die due to suicide every year. For every suicide, there are many more people who attempt suicide. A prior suicide attempt is the single most important risk factor for suicide in general population. Suicide is fourth leading cause of death among 15 to 19-year-olds. 77% of global suicide occurs in low and middle income countries. Ingestion of pesticides, hanging, and firearms are among the most common methods of suicide globally. Let's have some more. Every hour, a student commits suicide. India accounts for 17% of people who commit suicide across the world, and hence India is also called as suicide capital. How worrisome it is for all of us to know that our country is called as a suicide capital. Nearly 80% of those who commit suicide are literates. This is another important data that we all need to look at. We are all literates. We all have some kind of education, but vulnerabilities do exist even among us. So what are the causes of suicide? Let's also understand what are the causes, various causes of suicide. Biological, doctors, as you are doctors or medical students, you will know decreased serotonin in brain. Anatomically, this could be one of the reasons for suicide. When it comes to mental health issues, around 60% those who die have underlying mental health issues. In fact, Dr. Kishan was mentioning some people will be going through depression, some people will be going through schizophrenia, some people will be going through substance abuse, some people may be going through bipolar, people may be going through personality disorders. So there could be many other mental health issues underlying, which may also become a causal factor for people committing suicide. There are lifestyle issues, as we already discussed, addiction to drug, alcohol, etc. Environmental aspects, loss of loved ones, exposure to violence, war, or any traumatic incident, and negative life experiences like bereavement, divorce, loss of job, financial worries, and so on. So these are the broader classification of causal factors for suicide. And what I have also seen among many students is the unmet expectation that they have kept for themselves or their parents or their society has kept on them. Well, a momentary feeling of extreme hopelessness becomes a major causal factor for suicide. It is very momentary. However, that moment can make or break the individual. Lack of sense of belongingness pushes them further into the crisis. In this modern society, this is one of the major problems, that we are all work or we function as isolated islands, where there is no connection between the two, or where there is no connection among the islands. Many times we do not share our issues, our problems with our loved ones, whether it is our parents, our siblings, or our cousins, or whoever, our close friends. We do not share. We think that my problem is only my problem and I only have to solve it. And that is where the problem comes in. Well, as doctors or as students of medical science, I thought that this could be an interesting tool that you all can use. That is Qpr Technique by Qpr Institute, which is recognized world over. What Qpr stands for? Question a person about suicide. If you feel that the person is somewhere showing any kind of symptom of suicidal ideation, then question him or her. Then persuade someone to get help. That's what, as I said in the previous a few seconds or few minutes earlier, that we all think that we are capable to handle our issues and we do not share it with others. So persuade people to get some help and refer someone to the appropriate resource. If you feel that the person needs a psychological care, then refer him or her to a psychiatrist or a psychologist so that they will get addressed or the issues get addressed. Qpr is not a form of counseling or treatment, of course. Rather, it is intended to offer hope through positive action. It is intended to create hope through positive action. And when you are questioning, when you are persuading, and when you are referring, you are taking a stand for that person, which also gives a sense that you care for them, which is very, very essential. And that makes the person feel more secure. So that's why please use QPR technique whenever you feel there is some kind of vulnerability with anybody for that matter, whether he or she is your friend, classmate, or colleague, or whoever. Well, collectivism is very much necessary. We are, I mean, if you compare, there was a sociological study as well, long ago by a sociologist called Emilder came, and he also realized that people who lived in joint families always uh, kind of had some kind of resilience. Okay, there is a request to explain QPR technique again. I'm just going back to the slide. So QPR technique is very simple. Whenever you find any person having any kind of suicidal ideation, or if they start speaking about suicides, or in case if you feel that the person is kind of depressed and there is a possibility that he or she may be taking any drastic step, then stand in front of them. It takes a lot of courage. As I'm talking about it, it may be easy to talk about it, but to do it, it takes a lot of courage to stand there in front of the person and question if the person has any ideation of suicide. And a lot of people will have a counter question to this aspect, that are we putting this thought into that person's mind? No, you don't have to think like that. You will not be putting the thought of suicidal ideation into their minds. Rather, you are giving a sense of belongingness. If you're asking this question, you are making sure that you are there for that person in the first place. And if the person acknowledges that, yes, they feel vulnerable, then please persuade them to get some help. And if you can be there to help them, be there. If not, at least persuade them so that they can get someone to their help. And also refer them to the appropriate resource, specifically psychologist or a psychiatrist, so that their suicidal ideations or the root cause of their suicidal ideation can also be addressed, so that they are out of danger. Because every life is very much precious. Hope the QPR technique is clear, and let's move on. The collectivism is very, very important, as I said. And moving on, this is an experiment that I did. And in fact, this is a model that I have also given to many people, many institutions, that is called as Happiness Club. As students or as employees of an organization, the best thing that we can do is we can be there for each other. In any institution for that matter, there will be different clubs, social clubs or speakers club or singers club. There will be different club, cultural club. So there are different kinds of clubs that will be existing in institutions. Can we start establishing happiness clubs? And what is the idea of happiness clubs? In happiness club, what we are intending to do is we all join together and start sharing all our emotions with utmost authenticity. Which means if you are feeling extremely happy for something that you have really achieved, then you will share that happiness. If you are feeling irritated, you will share why do you feel irritated. If you are feeling angry, you will share why are you feeling angry. And if you are feeling extremely vulnerable, then you will share that you are feeling vulnerable and why is it that. And if you are feeling stressful, especially in the COVID time, I have worked with a lot of doctors, and one of the foremost things that they had is stress. Of course, for a very valid reason. They were serving the society, but at the same time, self-care was very, very essential. And what we did is we created this happiness club where people started sharing that, yes, I'm feeling stressful. They started they started acknowledging their emotions. They started acknowledging their experiences. They didn't suppress anything. And the result was they started developing a bond in the first place. The second is they started feeling that other people are also there with them, and they started feeling that I'm not alone in this journey. It's not just with doctors. I've done this with students. I've done with with the employees of organizations, and everywhere we have got tremendous results. Because in general, in our society, we do not have a very secure space where we can express our emotions without putting any filter, without having a second thought that what will happen if I express this. So please, in case if you can create happiness clubs, of course, I have a specific or a very detailed module for that. I can share it with you so that you all can start happiness clubs, maybe a group of 10 people, 15 people, so that it starts giving results for you. And not just, and it will definitely bring in collectivism, even though we are kind of sharing or we are living in an isolated space. Well, now coming to another core area, that is, how do we keep up good mental health? What are the methods for keeping up good mental health? Have a routine. This is something that a lot of people miss out. Generally, of course, you all will be kind of aware that what is circadian rhythm, or what is how it impacts how biological clock works, etc., etc. However, theoretically we know, practically we do not practice. That's a problem. So have a regular routine. Sleep at a specific time, wake up at a specific time, so that your biological clock is intact. Of course, this is something that I do not have to share because you're all doctors and you can tell better to me. Drink more water, eat good food, exercise. But one more thing that I would like to add: pause whenever you feel overwhelmed. You should know this pause button in your life, so that whenever you feel overwhelmed, you can take a pause. Then engage in good hobbies. It can be reading, it can be writing, it can be drawing, it can be coloring, it can be knitting, it can be singing, it can be dancing, it can be anything of your choice. But every day engage yourself in some good hobby so that it energizes you for the next day. Avoid too much of social media because it kills a lot of time. Not just that, it also brings a lot of stress. Again, another major problem that I see among youngsters is binge watching. Of course, very, very interesting series are coming on these platforms. They are addictive, and hence we should ensure that we do not get into binge watching. And set up a worry window. This is another very interesting aspect that I would like to share with all of you. How many of you get worried? Can you share? How many of you get worried once in a while, maybe? Or how many of you are worrying about one or other thing on a regular basis? Right? How many of you get worried? Can you put it as, yes, I get worried? I also get worried. Can we have some responses? Yes. Okay, we do have worries in our life. Fair enough, which is normal, which is natural. But how do we deal with it? A lot of people do say me that because of one worry, your whole day gets ruined. Because of one issue, you are wasting a lot of time, productive time, for worrying. So what the idea is, keep or set up a worry window. Now, what is this worry window? Have a specific time which is convenient for you on a regular basis. In the sense, if you have a regular routine, then you will have a fair idea what would be the good time for you to have this worry window. At that specific point of time, utilize that time completely for worrying about all the worries that you have in your life. And that will ensure that you will not be worrying at other points of time. If you get any worry at any other point of time, you will tell yourself, okay, I'll keep this for my worry window. If you get any worry after your worry window, then you will tell yourself, okay, this, I will worry about this the next day. Of course, there may be some emergency situations for which you may have to worry. I'm not considering them. I'm talking about daily life worries that we generally have. Great. Yogasana, pranayama, dhyana, etc. are very, very important and create a support structure for our lives. So please engage in all these. And journal writing is also a very powerful tool where you can actually look at your emotions and thoughts, and they become a kind of reflection for yourself. And other things, some of the other things that you can keep in, that you can engage in hobbies, or you can engage in some creative activity, doesn't mean that you have to force yourself to do something. And you can, of course, I also understand that free mind is very good for creativity, but again, don't be in a kind of stress that you have to create something out of your free time. You can relax and you can stay calm. And one more thing that you need to do is community outreach. This is a very, very powerful tool. The moment you engage with community, the moment you engage with people, definitely it enhances your energy levels. Now, I request all of you to focus. Of course, couple of things, what I shared till now, may be there in your awareness already. But now it is a very serious aspect and very, very important aspect of this talk today. That is, I'm going to share the mental wellness formula with all of you that I have created. What is this mental wellness formula? One of the questions that came to me in one of the discussions is, we have always been talking about mental illness and treatment, and also we are talking about breaking the taboo. But we are not really talking about mental wellness. Or even if we are talking in the sense of we need to achieve mental wellness, but we really do not know what mental wellness is. That is the primary question. If you do not know where to reach, then how can you even start your travel? Or how can you start your journey? So that is when this thought came to my mind. I thought, let me start defining what mental wellness is. And with this process with this thought process, I got this formula called REST, where R stands for resilience and reflectivity. E stands for equilibrium of ABC, that is affection, behavior, and cognition. S stands for sense of satisfaction, fulfillment, and gratitude. And T stands for true perception. Let's look at it in detail. What does resilience mean? Resilience is the capacity to bounce back. I'm sure most of you must have seen that ping pong ball which bounces back with lots of energy, a small tiny ball. In the same way, resilience for us is the ability to bounce back. Whenever you are in a bad mood, whenever you are in an angry mood, whenever you are disappointed, you expected something really going to happen, but it didn't happen. When you feel sad, the ability to come back to normalcy is called resilience. That is something that we all need to develop for ourselves. But the question is, how do we know that we are not in normalcy? For that, the answer is you have to reflect on your emotions, on your thoughts, and on your behaviors. So reflection is something like, how many of us look at the mirror every day? We look at mirror every day in the morning, maybe in between, maybe in the evening, or whenever we are going out, we have this consciousness in our mind that we will look into the mirror and then go out. But how many of us hold a mirror for our emotions or our thoughts or our behavior? Most of us do not. So what I'm suggesting here is we should start mirroring our emotions, thoughts, and behavior. And how do we do that? By asking questions like, how am I feeling now? What is that exactly? What is that I'm feeling? And where is this feeling coming from? Similarly for thoughts, similarly for behaviors. The moment you have these questions in your hand and get an answer to each of these questions, that's when reflecting becomes very easy. And once you have reflected and you realize that you have derailed from normalcy, then utilize any resilience tool so that you come back. Okay, I've been talking normalcy. I'm sure a couple of you might have had this question, what this normalcy is, right? Like when it comes to blood pressure, we have 80/120 as normalcy. When it comes to blood sugar level, we have something called normalcy. But then when it comes to mental wellness, what is normalcy? The answer is equilibrium of affection, behavior, and cognition. What does that mean? Equilibrium refers to an equimixture of all types of emotions, all types of thoughts, all types of behaviors, which means you have an access for any kind of emotion, any kind of thought at an equal distance. If you want to feel happy, you can feel happy and come back. If you want to feel anger, feel it and then come back. If you feel disgusted, feel it, come back. If you feel sad, feel it, come back. So primarily, I'm not saying deny your emotions. Experience your emotions. Experience to the core, but make sure that you come back. And the third aspect is sense of satisfaction, fulfillment, and gratitude. And when I say this, satisfaction refers to being able to do whatever is there in your capacity. If you can do something in your capacity, and if you're doing it, that gives a sense of satisfaction. So living to the fullest, doing anything and everything to the fullest gives that sense of satisfaction. And when it comes to fulfillment, whatever we may have, materialistically or non-materialistically, ensure that you have a sense of fulfillment. I'm not saying that don't have aspirations. You can definitely have aspirations. Higher aspirations are always good so that you continuously go on achieving bigger things. You continuously achieve or scale up greater heights. But if you really want to do that, you have to have this sense of fulfillment with whatever you have. That will ensure to give that positive energy so that you can take that as pedestal to scale up the heights. And sense of gratitude is so important and so heartening emotion that anybody can experience. Not just to the one who is at the receiving end, but also to the one who is expressing it. Whenever you express gratitude, it makes you more humble. It breaks away your ego. It makes you get connected with the person who has helped you. At the same time, the one who has really helped you gets reinforced to help many more people. So you are actually reassuring to the person that whatever he or she did is meaningful and you are grateful to it. And last but not the least, true perception is so important in the sense, are you perceiving the things as they are? Are you perceiving the things in their truest sense? Or are you giving your own meanings to things that you see? This is so profound and something very, very important for all of us to understand. Suppose I just give you an example. Suppose two people are speaking to each other, and at the same time, you enter that space and they look at you and start laughing. Now, most of us will end up thinking that probably they are laughing at me, probably they are making fun of me, probably they are gossiping about me. But when in fact, they might be laughing for a joke that was part of their conversation, which had nothing to do with your presence. So, what I'm suggesting here is whenever you have any kind of experience, try to understand it in the truest sense so that you will not get into the vicious cycle of negative thoughts. Otherwise, you may start worrying that probably they are gossiping about me, probably they are thinking bad about me, probably they are biting in the back or whatever. And you will get into this vicious cycle and you will ruin all the time and beautiful moments that you can create for yourself. And when you have all the rest, all the 4 aspects of rest or 5, 6 aspects of rest, I guarantee you that you will sleep like a baby. You will sleep so peacefully that you have no worries at all. And when you have a very good sleep, that will definitely ensure that you do not get triggered with anger, frustration, irritation for small, small things. Haven't you noticed this? Whenever you are sleep deprived, your anger levels are high, your frustration levels are high. You get irritated even for a small thing. So ensure that you have a very good sleep. And that is the rest formula. And when you implement rest formula in the real sense, I take the guarantee that your mental well-being will be there at 100%. You will, of course, challenges will be there, difficult situations will be there, but the way you handle them will be completely different, and it will be, you will transform yourself as an individual. But you will have to practice this formula regularly. It will not come just by theoretical understanding. Why? Because if a person has to climb up this hill, and if he just starts climbing up, then he will be in this kind of situation where he is tired, feeling exhausted. But if a person is doing a regular exercises, or at least he does warm up and then starts climbing, then he will be like a king on the top. That is what I want to create with all of you who are listening to this lecture, so that we can create a mentally healthy society. And in case if things are not manageable, even after practicing this formula, then definitely reach out to a mental health practitioner. And my suggestion is to reach out to a psychologist first, so that they can look at the root cause and then see if you need a medication. Definitely they will refer you to a psychiatrist. With this note, I'm open for question and answer. And yeah, we can have many more discussions.
Mr. Akshara, I had many doubts and I needed some clarifications. But after your presentation, I have nothing left in my mind to clarify, to be frank.
Thank you.
I had heard a lot about you and your achievements, but today I could witness for myself why you are so famous and why people love you so much. Your presentation was crystal clear. I myself present a lot of things, but this is something next level. Anyone for that matter, need not be a medical student or a doctor. Any layman can clearly understand these concepts, and the presentation you have made now, this is very beautiful and fantastic. And yeah, I could not take my eyes off your presentation, to be frank, even for a second. Yeah, in the beginning of the presentation, I had many doubts in my mind, but now I don't think. But anyway, on behalf of all others, for the benefit of others, I request you to stress more because being students and nowadays youth, young generation, are more addicted into the social media. So if you could suggest some techniques to de-addict ourselves from social media, or some people have that excuse to say that I use the social medias for relaxation, for entertainment purpose only. When I'm stressed up, then I'll use it for some time for a relaxation. That's the excuse they gave. So is it right in justifying that way, or how can we? Yeah, if I'm addicted, but I want to come out of it. So can you suggest some good techniques for it, please?
Sure. Very interesting question, because in today's world, social media has become part of our life. Without social media, I don't think, probably we wouldn't have connected, or lots of connections do happen through social media. So I think it's part and parcel of our life. So, and I'm also not against social media per se, because it also, social media also has a lot of good content for us to understand, us to realize things. So what I would suggest is, for all of those who have got addicted with social media, the simple thing is practice reflectivity, so that the first second of R of rest formula, so that you're realizing how long I have been using social media. Have I been spending too much of time on social media, so that you can actually see, if you have been spending say 3-4 hours in social media, then you will know that yes, it's too much. If you have spent half an hour to 1 hour at different intervals, then it's fine, because you might be doing something interesting, or you might be getting relaxed, you might be feeling happy. So uh, when social media is in your control, in our control, then it's all right. But only when it gets extended. That's why I was very specific about the series that comes on OTT platforms, because the moment you are into it, then it will keep on it will show a carrot towards the end, so that you are tempted to go to the next episode, and towards the end you will be tempted to go to the next episode. So be mindful of how much time you are using, and if that is an appropriate time. Especially for students, I don't suggest much of time to be spent on social media, because another problem that I'm seeing among all of us, including me, that our reading habits are going down. We are not reading much, and reading is very, very important to stimulate our brain. And some of the studies do say that the more you read, your old age is pushed forward. So if we have to remain young, then we have to read, and reading gives a lot of insights. So uh, apart from whatever social media that you use, yeah,
Sure. How
please
do
go
we
ahead.
understand whether I'm really overusing it? What's the limit? How do we realize whether I'm overcrossing or not?
Again, it depends on individual to individual, because say suppose there is a digital marketing person, then they may spend a lot of time. But for students, I suggest half an hour to 45 minutes is more than sufficient, where they can get an access to all the social media, whether it is Facebook, Instagram, LinkedIn, Twitter, YouTube, all those things, or maximum 1 hour. Beyond that, anything beyond 1 hour is somewhere killing your time.
So, if we are using it for a productive purpose, like social for a studying purpose, now Studygram is there in Instagram. So, if you're using for productive purpose, by which see my one of the taglines of White Army is study mania in social media. Okay, because
Right.
instead of just for some look for some gossips or rumors in for entertainment, we can use the same for the study purpose as well. When we
Absolutely.
have some leisure time in between the
Yeah,
classes, also 10 minutes, we can use the Instagram just to browse through some like academic materials. Still,
definitely. No, that such things are good, because say when I'm talking about social media, I'm talking mostly about networking sites. But if it is used for good, then I'm all in support of it. Because I have seen a fifth standard student. He's my client, and he has watched so many world history videos, and he can narrate with so much of precision. He can talk about Hitler. He can talk about Napoleon Bonaparte. He can talk about Russian Revolution. A fifth
yeah,
standard student.
yeah.
So that shows that YouTube is not bad all the time. So I'm not against social media. If you're using it for a good purpose, definitely go for it. But if you're using just for liking and commenting photos, then that's it. That's something that we need to reflect upon.
Akshara, today's session has been attended by one of the happiness coach and a workspace happiness specialist, Mr. Sunil Kumar. He has been enthusiastically watching your session. He has asked for how long to use this rest formula, for how frequently or for how much duration we should be using.
Well, rest formula, if one starts practicing on a regular basis, then it becomes part of your life. So I'm suggesting this to be used every day. Say it's a lifelong formula to be used, just like BP tablet. Once you get it, then you can't stop it. So similarly, rest formula, if you start it, and once you get a hold on to it, then you don't have to stop it. It becomes part and parcel of your life, so that you are assured that your mental wellness is intact.
Thank you, sir. Thank you very much.
Yeah.
Thank you. Thank you for joining the session.
Any other questions from any? Rahul, you have any questions? Others, all our active members can take direct expert opinion here. I like that tagline also, Akshara. Medication without medicine. We also believe in that. See, we being the doctors, see in our OPDs, in our clinical practice, that nearly 70 to 75% of the patients are having psychological issues rather than any real problem. So if you just with words of consoling or some like if you just assure them with proper convincing words, then they'll get better with just mere words. No need of any. Only hardly 20 to 25% of the patients require these medications or any surgeries or so. So this plays the counseling part plays an important role. In abroad, we have separate counselors. The doctors, like physicians or surgeons, don't do this. Instead, they refer to a specialist counselor to do for any patient for that matter. Even after the surgery, after any trauma, anything, they'll send them directly to the counselor so that they keep a good sound mind, and they'll be well assured about their mental health. They don't have any agony or anxiety about their health. But in our country, there is still some amount of stigma left behind for that. Even for attending the session, maybe if they attend they may think that people may brand them as having some mental issues. They fear to attend the sessions also. They don't want to reveal themselves. This is the stigma still persisting in our country. So we have to come out of this. Okay, see, nowadays we have seen in the recent Olympics and the cricket stars and all our the Bollywood and Hollywood actors coming out openly with whatever the issues they're having, and trying to create an awareness. So there is nothing to feel shy or ashamed of ourselves. Nobody does it for a purpose or for themselves. It happens somehow, but if you take proper steps in the right time, that's important. Not after its limit is crossed. If we take in the right time, if we proper precautions and proper directions from the expert, all these suicides and depressive events can be definitely prevented. The main purpose of having your session today is, it is not just for those who are suffering from these. This is for normal people, especially to prevent. How can we prevent? By following like your formulas. We can, in our normal day-to-day life also, we can use these formulas to prevent having such episodes or such illnesses in the future.
Yes.
Brilliant presentation. I should really applaud you and your presentation. Excellent. I am really overwhelmed with joy today. I can't express really.
Thank you. Thank you so much.
It will be definitely, this session would help thousands of people out there. And Akshara, another request. As in, when you are free or it's convenient for you, please do take some specific issues of psychology important for the general public, and please be the mentor of the White Army. That's all. On behalf of all the members and the those who got benefited by this session, we thank you. Any concluding remarks from your side?
It's my honor to be here. And the moment you asked me to speak for your fraternity, I was very proud of whatever you're doing, because very less professionals do take care of their fraternity, the upcoming students, and the way you are handling all these things is very, very essential and very, very commendable. Thank you for doing this work for all doctors so that we can create many more intelligent and sensitive doctors for our country. And it will be my honor to be part of this army who are going to create wonderful impact in our society. Thank you so much.
Akshara, one thing, see, our motto of White Army is help others to help ourselves. See, my today's intention was to help others through your session, but in turn, I only got benefited a lot by these formulas, whatever you taught. I feel that will help me a lot. So this is what happens when our intentions are pure and selfless. When you're always ready to help others, indirectly somehow you only get benefited. So once again, thank you so much. You are our own, my best friend. I'm really feel proud to say that you are my friend and brother. Okay.
Thank you so much.
And we will have many more sessions like this for our members. Thank you so much once again.
Thank you. Thank you so much.